reform plan, throw out the House and Senate bills, start over from square one. This time, they say, with true bipartisan input. Republican Senator Orrin Hatch is on the Health Committee and joins us now. Senator, thanks very much for joining us. Of course, the White House says that they do have bipartisan elements in this, and that to start over means not to have anything, that it would take way too long, and it would mean waiting another 20 years, that they've worked this hard. Why not take the building blocks and do a stripped-down bill such as Harry Reid is proposing?
Well, because it's not a stripped-down bill, it's a $2.5 trillion bill, and they even add another $75 billion on top of it, and there's no way to pay for it. Now, keep in mind, we're already spending $2.4 trillion on health care in this country. You add another $2.6 trillion now to that bill, and you can imagine the American people just can't live with that.
Of course, they would dispute your numbers, but I'm not going to argue the numbers here. But what would be wrong with taking some of the work that's been done already, the things that you guys can agree on, some of the, crossing state lines and letting people buy insurance without those kinds of barriers, some of the other reform measures that are smaller issues?
Well, first of all, the bill that they're going to put up is a total Democrat bill that literally brings everything to Washington, gives Washington the power over health care, and of course won't work. So we really do. We could start over, and I think with a group of us, we could have a bill within a month that would be a great bill that would bring American people together, would save money over the long run. And I'm worried, sick, that we're going to pile, like you say, another $2.5 to $2.6 trillion on top of what already is a huge, costly health care program in this country, and without the money to do it. And I just don't think we can afford it.
Well, Senator, they say that it's paid for, but that put aside, let's say when you guys get together tomorrow at the Blair House, and we'll all be watching, the whole nation's going to be watching this, let's just assume, and I think it's a pretty safe assumption, the president's not going to say, okay, I give in, let's do it over. Let's start from scratch. So assuming he doesn't do that, is there any give here? I mean, do the Republicans, do Mitch McConnell and the rest of you all just sit and say, well, and if you're not going to do it over, we're not going to talk? Or do you start negotiating in public, point by point, on some of the things where perhaps there could be consensus?
Well, first of all, you can't do that in 6 hours. That's what that is a photo shoot that really isn't going to do anything about health care other than talk about it. And I think you'll find a lot of accusations going back and forth in that particular meeting. But look, yeah, we could do health care in this country, but their goal is to have the federal government control health care. They want to push us towards a single-payer system, which by any definition is socialized medicine. And our goal would be to have the 50 state laboratories do health care with the help of the federal government, and do it in a way that we would have 50 state laboratories we could look at and pick and choose among the best programs, and do it in accordance with each state's demographics. New York's not Utah, Utah's not New York, or should I say Massachusetts and Utah. Both have exchanges, health exchanges, but they're very different because they have different demographics. And if we have a one-size-fits-all federal government program that even their own actuaries said is going to cost a lot of money, and they do it with gimmicks. For instance, they put off the Cadillac health plans to satisfy the unions till 2018, even after this president is going to be gone. They also put off a whole bunch of other costly programs for 4 years, even though this president may not even be president at the end of his first term.
Well, we're going to have to leave it there because we're out of time, but please come back tomorrow or the next day, whatever. We want to talk more about health care and what you're going to be proposing. Thanks very much, Orrin Hatch. Thanks for being with us, Senator. And that does it for me. This edition of Andrea Mitchell Reports. Ray LaHood still testifying. An extended testimony by the Transportation